RBA started simply because I've been in the field, working in the field for a couple decades now of recovery, and we work really hard to help people find recovery, get on the pathway. And we'd get somebody a new job after 2-3 months sober, they'd get back to work and they'd find their new best friend. Their new best friend likes to do a little recreational substances, and they would do that at break. They'd come back, we'd find out that they've been using, and the person that they're doing it with doesn't quite often understand that it might take this other person down. And they're not going to be able to go to work anymore because their addiction took over. How could we combat that from our standpoint? What can we do is what we started asking ourselves. And we looked around the country at what other people were doing, how that we can start to support that employee in their workplace. How can we help support the employer to see the need for this? And that's when we saw that the National Safety Council had a calculator of how much it costs each employer in their industry, with how many employees they have, how much it actually costs them on an annual basis to retrain, to have less turnover, to the sick days, the healthcare costs, how much it costs each employer. And it was an astronomical amount of money. So we asked ourselves, well, what else is happening again out in the world? And what can we do here to start to support that? So we brought the program together with all the aspects that we saw of best practice in the world. And we brought them together in Recovery Business Association to bring to your organization.